Hello, in this video I want to talk just a little bit about muscle origin, insertion, and action. These are concepts that some students struggle with when they're studying muscle anatomy. So we're talking about skeletal muscles. These are the large muscles that move your body. And they move your body by pulling on bones. Muscles only pull, they never push. Okay? Every skeletal muscle has certain specific characteristics. Like blood supply, obviously skeletal muscles need blood for oxygen and nutrients and to remove waste. Every skeletal muscle has a nervous system supply. We call that innervation. And every muscle has an origin, insertion, and action. So we're going to concentrate on origin, insertion, and action in this video. The origin of the muscle is the muscle attachment site, typically on a bone, that does not move when the muscle contracts. While the insertion is the other end of the muscle. It's the muscle attachment site, typically on a bone, that does move when the muscle contracts. So think of a muscle as having two ends. Okay? One end is attached to a bone and the other end is attached to a different bone. Okay? The origin is going to be the muscle attachment site that doesn't move. It's the stabilizer when the muscle contracts. And the insertion is going to be the muscle attachment site that does move when the muscle contracts. Action is simply what's happening when the muscle is contracting. Okay? In terms of what's happening with the origin and insertion during the muscle action, the insertion moves towards the origin during the action. Because don't forget, the insertion is the moving point and the origin is the stabilizing point. So during a muscle action, the insertion is pulled towards the origin. Typically, these movements occur at a joint, also known as an articulation. So an articulation is where two bones meet. There are some actions that occur at not a joint, right? For example, a lot of the muscles involved with facial expression, like smiling, there's no joint there, right? And in this case, the insertions are not on bones, but they're on other tissues. So for example, the muscles for smiling are the zygomaticus major and minor, and they go from your zygomatic bone to the upper corners of your lip, right? So the origin would be the zygomatic bone, that's the stabilizing point, and the insertion is going to be the soft tissue on the upper corners of your lip, pulling your lips up towards the origin, pulling the insertion towards the origin. Now I want to talk a little bit about the actions that are performed by our skeletal muscles. So these actions are our large body movements. And you're familiar with some of these terms like flexion, for example, right? So let's start with flexion and extension. So these are opposite actions. A flexion is typically when we bend a joint and the angle between the bones becomes smaller. So for example, when you flex your elbow, you go from 180 degrees to less than 90 degrees. That's flexion. Extensions are an increase in the angle, and it's a return to anatomical position from a flexion. So flexions and extensions typically occur in the anterior-posterior plane. Abduction and adduction are opposite actions too. And these are dealing with movements going from the midline towards the right or left, or from the right or left towards the midline. So for example, when you raise your arm to the side, that's abduction. And then when you bring it back in towards the midline, when you add it back into your body, that's adduction. Rotation and circumduction aren't opposites, but they are similar actions. Rotation occurs when you spin something on its axis, right? Like when you shake your head no. A circumduction is when you make a big circle on one end and a small circle on the other, right? So if you were to draw a big circle on a chalkboard, right, that would be circumduction. Supination and pronation are actions that occur on the forearm and palm. So when you're in anatomical position, your forearm and palm are supine, right? So supine means your palm and forearm are facing forward, okay? And to pronate, you have to turn your forearm and palm to the posterior. So you're going to have your back of your hand forward and the back of your forearm forward. That's pronation and then supination. Dorsiflexion and plantar flexion are movements that occur at your ankle, right? So when your heel comes up and your toes go down, that's plantar flexion. You're planting your toes in the ground and your heel comes up. Dorsiflexion is the opposite action. Your heel comes down and your toes come up towards the front of your lower leg. And then we have elevation and depression. Elevation and depression are just movements that go inferior or superior, like when you lower your mandible or raise your mandible. So lowering the mandible would be depression, and raising it back up would be elevation. Now, I think what's really important to understand about these actions is that a muscle, when it comes to the actions that are opposites, like flexion and extension, a muscle can only do one and not both. So a muscle that causes flexion will never cause extension at that joint. A muscle that causes abduction will never cause adduction at that joint. So let's look at an example. So you have a muscle called the brachialis muscle that goes from your humerus to your ulna, and it crosses the elbow on the anterior side. The humerus is the origin and the ulna is the insertion. So the insertion will move towards the origin during the action, meaning the ulna will move towards the humerus when that muscle contracts. So the brachialis causes flexion of the elbow. Muscles only pull, never push. So the brachialis muscle cannot cause extension of the elbow, because in order to cause extension of the elbow, the brachialis would have to push the ulna away from the humerus, and it can't do that. Muscles only pull, they never push. And this is a common problem area that students struggle with. They'll tell me that, the brachialis muscle both flexes and extends the elbow, but it can't do both. In order to extend the elbow, you're going to have to pull the radius or ulna on the backside towards the humerus on the backside. And that's the job of your triceps brachii muscle. So hopefully this video helped you out a little bit in terms of muscle origins, insertions, and their actions.